A lot about an improvement in the number of cases new or otherwise going down for 14 straight days. You've also heard a lot more about testing. We need a lot more testing so that we can know a lot more what we're dealing with here. I want to explore that with Scott Whitaker, the AdvaMed president and CEO, and the former chief of staff over at the Department of Health and Human Services. Sir, very good to have you. Where are we on COVID-19 testing? I know there are a variety of such tests available, including one that will look at antibodies, which could indicate whether you even ever had this yourself, but update me.
Yeah, we're scaling up dramatically. March 12th was the first test that was approved by the FDA, so at that point, very few tests were being conducted at the time. Today, there are about 20 tests on the market. We're scaling up to the point where we'll have about 28 million tests available by the end of April. So it's tremendous progress. But, Neal, that's just on the front end of diagnosing the disease. On the back end of determining how much immunity you have, those tests are in the process right now. We'll see more of those in the coming weeks as well as we work through the process with FDA.
You know, Scott, I know there are a variety of different tests. The idea is to get a good, strong sampling to know exactly what we're dealing with here. I know that we had started a little slow in this country where 1 out of about 300 to 400,000 Americans are being tested. It's dramatically shrunk to, I'm told now, under 100,000. Right. And I'm just wondering what you, as a top medical expert yourself, would like to see before even considering, you know, unwinding, you know, some of these sheltering provisions.
Yeah, I think there are two things, Neal. We need more testing for sure, and we're scaling up to do as much as we can. As I said, 28 million by the end of this month, and scaling up even more dramatically as we move into the summer months. So that's one thing that we need for sure. I think continuing the work that we're doing on treating the disease and also protecting healthcare workers is critically important as well. And then informing the public that it's not just diagnostic testing alone that gets people back to work, but it's diagnostic testing along with the CDC rules that they put on to continue the social distancing to make sure that we're phasing our way back into the workplace in an appropriate way.
Are you confident there will be an unwinding at the end of this month, the beginning of the next month?
I'm confident that it will begin unwinding soon. I don't know if it'll be at the end of this month or the first of next month, but I feel confident the way that we've scaled up, the work that we're doing with the FDA, to get more tests into the market, more penetration, more access. All of those things are being done at such a rapid pace. I am confident that the closer we get to the summer, the better prepared we'll be for reentering the workplace, and we're anxious about that.
Scott Whitaker, thanks for all your hard work yourself. Appreciate it very much, and for that update.